Welcome to the Anti-Aging Podcast, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Well, hello and welcome to episode number 4 of the Anti-Aging Podcast. I'm Teri Fisher. Great to have you along with us today. Today is yet another interview, and I'm really excited to bring to you the interview with Dina Wang. She is a nurse injector at Anti-Aging Medical and Laser Clinic, and we talk all about her background, which, by the way, is as an operating room nurse, and how she got into the field of aesthetic medicine. She's actually been a nurse injector now for 6 years, and she teaches courses on Botox and fillers and the whole bit. As well, we talk specifically about her interest and the importance that she places in facial balancing and making sure that the patient's overall experience is guided by the overall appearance and the symmetry. So let's get right into it. Lots of great content in this episode for you. And without any further ado, let's welcome Dina Wang onto the podcast.
Hi, Dr. Teri. Thank you so much for getting me on this show, and I got so excited. Hello, everyone. This is Dina from Anti-Aging Medical and Laser Clinic. I'm the nurse injector, as Dr. Teri mentioned. My background is OR nursing, so I've been doing operating room nurse for more than a decade, 16 plus years. I love it. But now I'm full-time injector, and also I'm teaching for fillers and Botox as well in BC. I'm full-time injecting for 6 plus years. It's been a while. And so far, I really enjoyed it. I feel like, oh my God, I feel so lucky. I can work at anti-aging. I can work with Teri. I can work with Dr. Frame. So yeah, this is me. So happy to be here.
Fantastic. We're happy to have you here. I was wondering if you could tell us a little bit about that transition. Like, how did you get into this field and why did you get into this field?
Okay, well, that's a long story, but long story short. So because I've been working in the OR before, so I know a couple of plastic surgeons. So they're always talking about, okay, we're doing some plastic surgeries, facial lifts, and maybe combination with injectables. And I got so interested in that injectable treatment. So one day, actually, we chatted a little bit in the OR, in the lounge, and they're saying, hey, Dina, do you want to get into that field? You can become a nurse injector. I said, wow, really? A nurse can inject? And they're saying, absolutely, you can. So basically, that's how I get into it. Then I take a course, and then I get trained. Then there you go. I'm here.
It's fantastic. Now that you're doing it, you're obviously very happy doing it. I've seen you work, and your patients love you. Yeah. They always have the best things to say about you. What do you love about it? Why do you continue to do this?
Well, I feel initially when I'm doing the job, being honestly, I feel okay. Hospital job is quite stressful. And just being honest, I'm a really transparent person, honest person, and I want to take something a little bit different. You've been doing one job for more than a decade. You want to try something new. This is just my personality. I always try something new to, get fresh mind. I said, oh, I'm so interested in cosmetic. Then I get into this field, as I mentioned. And later on, I thought, oh my God, after I inject patient and, they're super happy, I feel I can do something. So kind of if you go into the higher level, it's kind of like a spiritual health, right? Also, patient call it antidepressant injection. Basically, if they're feeling a little bit depressed or they have some emotional stress, they come to my treatment chair, they're saying, Dina, let's do something on my face. They can bring theirs a little bit confident up, and they're feeling happy afterwards. When they see the result, they're showing the result in the mirror, and they look at themselves, sometimes they have happy tears, and they're super happy. And I feel like I'm really satisfied for my job. You can do something to make this world a little bit better than how I found it. So I feel like quite meaningful. Does it make sense?
It makes a lot of sense, and it's such an important thing, because then, if I'm hearing you correctly, what I hear is like you do these treatments, but it actually helps them psychologically as well.
Exactly. That's what I mean. So because in our life, we're dealing with a lot of things. Like we're talking about health issues, physically, mentally, emotionally, spiritually. And, when we're doing cosmetic injectables, you're not only bring the patient like slow down the aging, but also you're dealing with the mental health or emotional health as well. Personally for myself too.
That's fantastic. No, I love that. So I want to talk about one of the aspects of this aesthetic medicine that you're interested in, I know, and that has to do with the concept of facial balancing. So perhaps you could explain a little bit to the listeners, like what does that mean? How do you define that, and why is it important?
Right. Okay. So in a if a couple years ago, Dr. Teri, you asked me the same question, which treatment you like the most? Probably I would say, I love lip injection. You can give a juicy, sexy lips for a patient. They're super happy. Or I can say, I love cheeks. Give it a little bit chiseled cheeks and a little bit defined, more contour your face. But after years experience, what I find from my patient, if they're following me for years, coming back to you, you look at them, if you only see one part of their face, you're missing something. You're missing that harmony of the face. You need to see this face like a whole face. Well, same when we're talking about health issue. We see a patient as a whole person. We talk about patient-centered care. We're talking about, our prevention treatment. That's a whole person, holistic care. So same as a facial injection. You see that face as a harmony. So I turn some patient away because the patient come back to me every month. They're looking for a lip injection every month. So you only see the lips on their face. They don't see other problems or other concerns. So I definitely talk to them and say, hey, probably you need to wait for a little bit longer, at least 6 months before coming back to see me. And they're saying, no, Dina, you did a really fantastic job on my lips. I love it. But personally, I think this is my business card. I don't want you to walk around showing the big lips and just one part of your face and saying, Dina did a good job. Because I want you to see your whole face like a balancing face and harmony face. And I also called airbrushing, like we talk about today. So do a little bit like a temple, cheeks, and tear trough, maybe a little bit jawline. So still you. I don't want to change the person to another person. Keep you as yourself, and because you're beautiful the way you are, but just want to make you look fresh and look like you had 30 hours sleep last night, look like you had a vacation done. People see you, you look so good, but they cannot tell, what did you get it done? They cannot tell. Maybe change some hairs and do some facials before. That's the whole point.
Yeah, that's great. That makes a lot of sense. I think a lot of it has to do with like educating the patient then, because sometimes they come in, like you say, and they may only be focused on one thing, but I think the consultation has a lot to do with education. How do you feel about that?
I totally agree. Absolutely 100%. Because sometimes patient got a lot of information from the website, from Dr. Google's, or from the friends, from Instagrams. So, and nowadays the social media really kind of misleading that point. You don't want to really everybody look the same, or you need to Russian lips or huge lips or higher cheekbones. Everybody, don't do cookie cutter or just one thing you see everybody does the same on the Instagram. Actually, they were filtered already. Probably you don't know that. And so I like to see my patient as individualized treatment plan and educate my patient. So, but still, I want to talk to my patient, what's your concern? It's not what I want, it's what patient wants. So then we can make a discussion and we can make same treatment plan with the patient together, then also within your budget. So budget also another issue. Education, budget, also the goal, what you have, then make a treatment plan, and step by step.
Before we wrap up, I just want to say we are so lucky to have you as an injector. I've learned so much from you already, being around the clinic, and I know that you also are involved with training and you teach through CBAM and some other resources. I wonder if you can just tell us a little bit about sort of the things that you do outside of the clinic that then you can bring back those skills. And I know teaching is one of them.
Thank you, Dr. Teri. I love working with you as well. Yes, I've been teaching at CBAM, so Canadian Board Aesthetic Medicine, and also Clear on Medical as a injectable trainers in BC. I love teaching. This is a part of it. Even back in the OR, I was the preceptor for all the students as well during that time. So I learned a lot from teaching. When I talk to the patient, I always can learn something from the novice injectors. I don't see myself as an instructor. I don't see myself as a teacher, but I kind of see myself as sharing a little pearls experience with the novice injector. And also we can learn from each other as well. So that part is valuable. So I really enjoyed it. And also I met a lot of new people, a lot of new friends, personality wise, and myself. I love to interact with people. So
that's wonderful. That's wonderful. Well, I think we'll wrap things up here for the sake of time. Thank you, first of all, for taking some of your time to chat with us on the podcast. It's wonderful. As I said, my experience in seeing patients speak about you is incredible. They love you, and I know they're constantly referring people to see you. So that's absolutely incredible.
Thank you so much, Dr. Teri, for having me here on the show.
Well, yes, it's been a pleasure. And I'm wondering, Dina, if you can also just share some ways that people can get in touch with you if they want to speak with you or perhaps even book a consultation with you. What are the best ways that people can contact you?
Absolutely. So, people can find me on my Instagram. So you can follow me, the Dina Nurse Injector, and on my Instagram, you can DM me any questions you have, or you can follow Anti-Aging Medical and Laser Clinic Instagram. The handle is Anti-Aging Van. So be free to contact me, or if you have any questions, be free to join the clinic and give you a free consultation. Stay beautiful, stay safe.
Well, I hope you enjoyed that discussion with Dina. As you could hear, she's extremely experienced. She is a wonderful person to work with. I can tell you that firsthand. And I can also tell you that her patients absolutely adore her. So if you are interested in working with her, I do encourage you to get in touch with her. And I know that she would be only too delighted to work with you. Thank you to you, the listener, as well, for tuning in today to the podcast. It means a lot to have you here. And we are looking for any reviews, honest reviews about the podcast. Any review helps us to get the word out and to help the podcast be discovered by other people that can benefit from the information that we have here. So if you are inclined, a review on Spotify or on Apple Podcasts or wherever you listen to your podcast would be very much appreciated. I look forward to speaking with you again next week. And as always, feel free to get in touch with me through my social media and my website at drterifisher.com, or of course at the anti-aging website at antiagingvancouver.com. Until next time, talk to you soon.
Thanks for listening to today's episode of the Anti-Aging Podcast. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.